Hey YouTube family, welcome back to my channel. That's a very informative video. It's gonna be a podcast with a Serbian student. He's a very good friend of mine, and I was getting queries from a lot of students. They wanted a proper information about Serbia from a student itself, not from me, because maybe they want some insight, and the students know more. So I bring to you my friend. He's Rohit Elio, and he will introduce himself so you guys can, if you have more doubts, you can put it on the comment section also. And over to you.
Hey guys, my name is Rohit Aldo, and I just recently transferred to Nish, and I'm in my fifth year now. And yes, it's been almost close to 1 year now in Nish, and it's just fun here.
Let's discuss more about the country itself. Firstly, I want to ask you about like what kind of passion you hold for this field, because I want to motivate students. Because the
Hmm.
medicine is a field which takes quite a long time, and many of them they think, oh, it's so long. Why should I study? Why should I study like that? But there are certain examples like you guys, even after facing so much of trouble, you're still going on to pursue that kind of stuff in your life. So I would like you to put light on this topic.
Well, like it's been changing ever since. Like if you talk to me about, if you ask the same question to me in first year, I would say because my parents always respected doctors, and then I see a lot of people respecting doctors, and then there's also this doctor title next to your name, and it was all these fancy things. And then as you get into this field, you realize how much respect you can have for this field of medicine. And now in my fifth year, if you ask me why I'm interested in medicine, it's just because of I see the efforts a doctor puts in to save a patient, and 6 years is no joke, man. Like, if you don't have respect for this field, I don't think anyone can survive 6 years being in this field. So yeah, basically just respect for that white coat, man. It holds a lot of power.
Totally, totally. I totally relate with that. It's a very great point you added on that. Uh, so I wanted to ask more about what's the study environment in Serbia? Because I've seen people going to some strange countries, strange universities, because they were influenced by some agents and they're not aware about the curriculum, what kind of curriculum they need.
Hmm.
Unless and until they're part of that hard curriculum, then only they can withstand the curriculum of India and the exam. So, what you will say about the place you're studying in?
Well, I think like I know the curriculum in Ukraine and I know it in Serbia, but I feel more calm in Serbia, and I feel I've taken a lot of more self-study time for myself here, because over here let's say we don't have exams every day, but we have exams throughout the year. There's exam sessions throughout the year, except for 4 months, like October, November, January, but all other months we have exam sessions. So, and when you go for classes, at least you can just prepare for that class before and go. But in Ukraine, you worry about the test and what's happening next. So, you have 2 months of just going through pediatric rotation or gynecologic rotation or any like whatever subject, and then after that you give your exam. So, you see all the cases and then you study, seeing the cases and then you read about it. It's more fun than just giving small mini test, and also towards the end the test is also oral, so the teachers grill you with vivas over here, so you've got to be ready for that as well. So but most of the things they teach in class, and not all the topics, because not always you find that specific case in the hospital, but all the common cases you always see. And yeah, that's how it is now.
That's great because anyhow, you need to know what kind of knowledge you're holding, and the tests and things they help a lot. And if you're not good, like you can understand if the teacher asks, and if you're not able to answer, you have some things kept like you can understand now which topic I need to more focus on. So it's a great thing. And I also want to ask you, what kind of people are there, like from which country, ethnicity, culture,
Hmm.
that are studying in Serbia apart from Indians? Indians are everywhere. They're studying
Yeah,
in
Indians are
all part of
everywhere.
the world.
I'm a little surprised for in terms of fifth year, because we had like 50% students from Ukraine, from UK, and there's 50% from India. So I mean, it's less Indians compared to what it was in Ukraine. But there's also Tunisians here. There's also Germans here, a few Germans, and there's all I saw one Italian. So it's a mix over here. But let's say it's again mostly Indians, and but there's only 60 students per year, so it's not like a huge group of people, but 60 students per year, 6 years, you always see them everywhere. So yeah, it's a fun group of people here.
So the thing is, you need to see one more thing. I like from any developed countries they're coming to this place. It means it's bringing some things and adding to this European Union, because I see this universities has link with various colleges across the Schengen countries and everything, and that's why many students are even coming here to do the UG and to have a better PG option over there. So what would you say about this? Like, what are your goals for like that, for
Oh, for
things like
sure,
that?
for sure. I think because this university has a partnership with a lot of universities, and also I think you talk to your students about Erasmus and stuff, and they're, I think, in the top league of the one of the Erasmus students, so they always have contracts with some universities in Europe, and most of them go for these exchanges as well. For me, I just transferred here, so I had a bunch of exams, so I'm giving it now. But for a student from first year to sixth year, I think he will have a lot of opportunities to move within Europe for, academic courses, exchanges, internships, anything they want. And the university is also very supportive in taking care of your documentations and sending it to the other universities. So in the university websites, you'll always see some opportunities happening. Even if it is not the universities, even like we can do this initiative to contact other universities and tell them that I'm from this universities, and they take care of that as well. So opportunities are endless. You just have to keep your eyes open.
Very well said. I also want to ask about the clinical rotations.
Mhm.
You have enough rotation? Like people are there, the patients are quite huge, the number, or
Mhm.
it's like whatever it is, can you tell it transparently to the students? Because I want you to say what's the truth. Because students, many agents, they try to flourish any kind of university, show the world it's like this and that, and I want you to be
So
transparent with it because students are not aware of it.
yeah, so I do not have anything to compare this clinical rotation because, but I've had more experiences here than any other. I just been in Ukraine, so and also for me, it's always, let's say, 3 hours of class we'll have, and we'll see all the patients around that ward. And some patients they speak English, so that helps us to take the history taking. But if we can't, if they don't speak English, the nurse or the professor translates each questions for us. And then, yeah, I've been taking patient history for some patients over here, so that has been fun. I've not got that opportunity somewhere else, but you always see all the patients in the ward the day you have pediatric class or gynecology or surgery classes.
Also, I got to know like the tech they're using, it's quite advanced, and they're using some kind of AI technology to teach students or some materials or to mimic a patient. Is it true or
I haven't seen anything of that sort, but in terms of tech, if you talk about the laboratory diagnostic stuff they have, it's all, I see a lot of Europe stickers, like it's co-funded by European Union. So I think that is why they have good stuff here.
Mhm,
But about the AI technology, I haven't seen anything of such. But maybe in the like basic years, like first to third year, they use it. But in clinical
mhm.
years, you anyway, more.
It's a bit, so I would like to ask you, this all were like formalities I asked you. I want to ask what kind of stuff, like extra things you're doing over there to
Mhm.
build up your morale and things, and how you're able to get the time for it.
Oh yes, yeah. Medicine is a tough thing to be if you don't have other hobbies. And I try to dwell into a lot of things. And over here, ever since I come to Serbia, I know that they are promoting sports a lot. You see a lot of playgrounds, you see basketball courts, football courts. So I dwell more in sports over here, and also go out for coffee, stuff like that. And there's also conferences, but most of them are in Serbian, and they let you come for the conferences. But in terms of gaining the value, I'm not sure because there's not always a lot of English conferences. But at least you get to attend. And if you have a student card, and if you say that you're a student in Serbia, you can attend any conference here in Serbia for free, be it medical or some other field. But obviously, we'll be going for the medical ones. And yeah, sometimes European doctors also come here and give their, what do I say, the presentation of their published papers. So that's been fun here.
Oh, that's great to be part of something. I have also attended various conferences. It's quite, amusing. You get to know various kind of professors. They are quite
Hmm.
reputed. They have given their whole life for that topic, so it's very respectful. And the last question for you would be, what kind of future goals you have, like what kind of
Hmm.
things you want to pursue, and what you want to say to this young generation, who the young aspirants who want to pursue medicine. What kind of things you want to tell to these people?
Uh, well, I didn't have a mentor before, but when I came here, I found a mentor for myself. So I have got good mentors now around here through networking. And for me personally, I do want to work in EU because I like the lifestyle there. I like going out to clubs and going to the mountains, driving cars. I don't know. In terms of lifestyle, it's different for everyone. For me personally, I like the European Union. It's not like I've been working there, but from what I researched and from the doctors I talked to, like, and also from being in Serbia, I do ask them about which country is the best working. I haven't fixed my country, but I've been learning some languages for now, just so that I'm not so far behind. So, and I'm in my fifth year now, so I started learning some languages, and yeah, EU is the plan for now. And also, I'm trying to find some universities which has a good PG program and not just like randomly just putting you to work from day one. So that's what I've been doing now.
One important thing I want to add, it's like not many students, even who got admitted in Europe and everything, they're not aware of doing some extra
Hmm.
things apart from the degree itself. Like for you, you are doing such kind of stuff. You're being part in social works. You're doing some kind of things that can boost your CV. Maybe it can be any kind of program in any particular topic of
Hmm.
medicine, but it's a must because I see when they apply for PG, there's not going to be many seats, especially in top universities. For any
True.
universities like super university, I'm not talking about. I'm talking about somewhere where actually the medicine is being
Hmm.
followed. And over there, if you want to be part of it, you need to have extra things because everything they have a certain way of putting
Hmm.
points, and they collab everything, whatever you
Hmm.
have, and the best person is suited for that college is
True.
selected. So, what would you say about it? Like, what kind of things you want to do, and what you have done that can help you
Like
more?
in first year, I just want to do something other than medicine, because when you study medicine for a long time, your mind just stops. So I was looking for extracurricular activities. So I've been part of some a lot of student organizations, and I've been running some in Ukraine as well. And ever since I've come to Serbia, I've been doing more academics, like in terms of researches and stuff like that, going for conferences, getting the certificates. Well, it's something of interest that it's out of interest that I do it. And the CV part is secondary, because if I keep thinking CV, I might do stuff that I don't like, and I don't want to do that. I genuinely like doing social work and volunteering stuff like that, and I try to do something medical related. By the end of the day, it helps in the CV and stuff like that. And obviously, if you're not in the top 10% of, like, if you're not the top 10 students in the universities, you need something in your CV to show that you're not in the top 10, but you are good as an overall doctor. So that is what I tried.
That's the thing I've noticed, like because many students of mine, they have given interviews for various university. Apart from knowledge, they are searching, like they're seeking what kind of leadership qualities this guy holds, and they're gonna have some, clingy questions that's not related to medicine, but it is like some kind of IQ questions, and it can trouble some students. So students should be prepared with everything. They should be a leader. If they're a doctor, they should be a leader. They can't be, they can't if they can't answer these kind of questions.
Yeah,
It's
and
very
also
strange.
whenever we treat a patient, it's always teamwork. So if you can't work with people, I don't, even the knowledge you have, it won't be shown towards the patient. So teamwork is something you build through all this. So that's how.
So I think it's quite enough for this video because we want to provide our students, our aspirants, the proper knowledge. We're not here to say what is the fees of this university. This is here, this is beautiful, it has this thing and that, because we want students to actually know what they will come into, like what will they face, what kind of education they will be a part into. That's our main motivation. This motto is, and that's why I keep creating podcasts with students who are actually studying properly. So thanks a lot for your time, and I hope we covered the major topics for this country. And if any of your viewers who want something more, he will surely connect with us later. You can ask all the things in the comment section, and we would like to help you guys out. So thanks a lot,
It
Rohit,
was pleasure.
for your
It
precious
was a
time.
pleasure.
We will see each other
Very
soon.
soon.
Okay,
Bye
bye
bye.
bye.
Take
See
care.
you.